Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Let's look at the gastric ulcer and the radiological findings. So first is, in case it is benign, there is presence of the Hampton sign. The Hampton line is seen. Then if it is malignant, there is presence of the Carmen. There is a Carmen meniscus sign. Now, what about the Hampton hump? There is something known as the Hampton hump. It is where the infarct in the pulmonary embolism. So, in case the infarct in the pulmonary embolism, it is known as a Hampton's hump. To learn and grow daily like this, please do subscribe.